morning, good morning, good morning. Good morning. This hearing is called to order. This is the public hearing of the City Council Committee on Public Health and Human Services, and the purpose of this public hearing is to hear testimony on Bill number 180888. I want to recognize the presence of a quorum of committee members. Members of the committee who are in attendance are Councilwoman Maria Quiñones-Sánchez, Councilman Al Toggenberger, Councilman Bill GREENLEE, and Councilwoman Blondell Reynolds Brown. And can we now have the clerk read the title of the bill?
Bill number 180888, amending Title VI of the Philadelphia Code, entitled Health Code, by adding a new Chapter 6-1200, entitled Pharmaceutical Sales and Marketing Practices, to provide for registration of pharmaceutical manufacturer agents and certain other requirements, and to prohibit gifts by pharmaceutical manufacturers and their agents to healthcare practitioners, all under certain terms and conditions.
Okay. And does anyone have any opening testimony before, or any opening comments? I would like to make a comment, and the first is that I'd like to thank everyone for being here today, and particularly the members of the committee who were able to make it, because as members of council, sometimes when it's time to take a vote, and the votes may not be comfortable for you, it's moments like this in which there is, has to be recognition where we're paying attention to doing what's right, we're trying to do what's right, where we are taking votes that are not always necessarily comfortable for everyone up here, but that is the job as a member of City Council that we are to do. That is what we are here for, to do our own research, to do our own homework, to pay attention to the issues at hand, and to address them. And so at the end of the day, the question becomes, where do you stand when history is written on particular issues? Where will we stand in terms of being a legislative body that is responsible for making very important, very tough decisions? Where will we be on the side of history when it's all said and done? And so again, I just wanted to put that out there into the atmosphere, and thanking the members for being here and for recognizing that this is something that's very important and very, very complicated. I don't believe that this bill is the end-all to be-all, but I do think that this will be something that will be helpful for what it is that we are trying to accomplish. And Philadelphia has a massive problem with opioids and heroin use and drug addiction in general. And anything that we can do to make a difference should be done, period. So again, I just wanted to put that out there, and I wanted to thank the members for being here this morning. And if we could call the first panel forward.
Carolyn Johnson, Deputy Health Commissioner, City of Philadelphia. Elizabeth Oquendo, Conflicts of Interest Officer, Temple University, and David Grant, Assistant Professor of Medicine, University of Pennsylvania, and Senior Fellow at the Leonard Davis Institute of Health Economics.
Thank you. Please state your name for the record and begin with your testimony. Dr. Johnson.
Yes. Good morning, Chairwoman Bass and members of the Public Health and Human Services Committee. I'm Dr. Caroline Johnson. I am the Deputy Health Commissioner for the City of Philadelphia. Thank you for allowing me to testify on Bill number 180888, which is sponsored by Councilman GREENLEE and Chairwoman Bass. This bill proposes to prohibit pharmaceutical company sales representatives from giving gifts to doctors, and would require that companies submit to the department copies of printed materials that they give to doctors during sales visits. We believe this bill will help prevent future health problems in Philadelphia caused by unnecessary and inappropriate prescribing of drugs. Today's opioid crisis began with the overprescribing of prescription opioid painkillers by physicians and other licensed medical providers. While doctors are certainly to blame for much of this problem, the physicians in this country didn't independently decide to start writing more prescriptions for opioids. They did it based on prompting of thousands of sales representatives from pharmaceutical companies that sell opioids. Many of these sales representatives told medical providers that the drugs were safe and non-addictive. The sales pitches were tragically effective, as we're seeing now. Between 1999 and 2010, the sales of prescription opioids quadrupled in this country, and this has led to tens of thousands of Philadelphians addicted to opioid pills, heroin, and fentanyl, and the crisis we are experiencing today in homelessness and drug overdoses. Furthermore, pharmaceutical manufacturers have continued to push opioids even up to recent times. Over a 29-month period between August of 2013 and December of 2015, pharmaceutical companies spent $46 million for gifts to physicians in the United States, encouraging them to prescribe even more opioids. Two of the top drugs that were promoted were fentanyl and oxycodone, which are among the leading causes of drug overdose deaths in Philadelphia. But this bill isn't really about managing the opioid crisis. It's about preventing the next drug crisis. While sales of prescription opioids are declining in Philadelphia now, the sales of other addictive drugs are on the rise. Sales of amphetamines, such as Adderall, increased more than sixfold between 2000 and 2016. Prescriptions for gabapentin, a medication used to treat nerve pain, more than doubled between 2015 and 2017 among Medicaid recipients. One of the key ways that sales representatives influence doctors' prescribing is by giving them small gifts, especially meals. The gifts aren't limited to the doctors themselves. The sales representatives also buy meals for the doctor's office staff, from nurses to receptionists, in exchange for listening to their sales pitches. While these gifts may seem harmless, studies have shown that they actually are effective. That's probably why drug companies spend billions of dollars every year on these marketing trinkets and meals. In one study, doctors who had received 10 or more free meals from opioid manufacturers wrote 5 times as many prescriptions for opioids as those who had not received the same number of meals. Our concerns are not just about marketing of addictive drugs, but rather all prescription drugs. Antibiotics are another example. Pharmaceutical companies have developed marketing materials specifically to counteract prescribing guidelines that are issued by the CDC. At least one company has been cited by the U.S. Department of Justice for making false claims about its antibiotics. The CDC estimates that 1/3 of all antibiotic prescriptions in this country are unnecessary, and that greatly increases the likelihood that dangerous bacteria will become resistant to antibiotics, which puts all of us at risk. Bill number 180888 would put in place minimal regulations to limit the aggressive marketing of prescription drugs. It would require that pharma sales representatives register with the Department of Public Health. It would require that they wear identification badges when they are making sales calls, and they would submit all written sales materials to the health department. Most importantly, it would prohibit sales representatives from giving gifts to doctors and their staff. And the bill would prohibit pharma representatives from giving discount coupons for addictive drugs to doctors for distribution to their patients. A discount coupon like that may just be what it takes to begin a patient on the road to drug dependence and addiction. It's important to point out what the bill does not do. The bill would not prohibit or limit pharmaceutical sales representatives from talking to doctors or other medical providers to promote their drugs. It allows for educational activities. The bill would not require that the Department of Public Health approve their marketing materials before they're distributed. It just requires that we receive a copy of them to see what drugs are being promoted and what claims are being made in the city of Philadelphia. Other cities and states and institutions have taken similar action to regulate pharma sales representatives. In Philadelphia, the largest health systems, Temple, Jefferson, and the University of Pennsylvania, all have policies that restrict the sales activities of pharma representatives. All 3 of these systems have submitted letters in support for their bill, and some of them are here to testify today. Patients in Philadelphia should feel confident that their doctors are making decisions based on their best interests, not what a pharma sales representative has been advertising or potentially misleading the doctors to prescribe. This bill, along with the administration's proposed amendments, will help protect individual Philadelphians from misuse of prescription medications, and it will help prevent the city from experiencing another drug crisis as severe as today's opioid crisis. Thank you very much for the opportunity to testify.
Thank you. You can please state your name for the record and begin your testimony. Ms.
Elizabeth
Elizabeth.
Okendo.
Yeah, I'm not going to mess up your last name.
That's
Elizabeth.
okay. That's quite all right.
Yeah.
Good morning, Chairwoman Bass and members of the committee. Again, my name is Elizabeth Okendo, O-Q-U-E-N-D-O, and I serve as the Director of Conflict of Interest for the Lewis Katz School of Medicine at Temple University. Thank you for the opportunity to testify today on Bill 180888 and its potential effect on the Temple Health community. As you may already know, Temple University and Temple Health is uniquely located in the epicenter of Philadelphia's opioid crisis. Our campus at Episcopal Hospital treats many opioid overdoses on a daily basis, and we have the highest opioid mortality rate in the entire city. Temple Health supports this bill because we believe that a pharmaceutical gift ban will help to protect not just the physicians that work at Temple Health, but those throughout the city from the undue influence of pharmaceutical marketing. The Lewis Katz School of Medicine implemented our own conflict of interest policy in 2012, which prohibits faculty from accepting gifts from pharmaceutical companies. This includes meals, travel, and other small transfers of values you may be familiar with, trinkets, pens, notepads, things like that. Our entire health sciences campus is gift-free. We do not allow pharmaceutical representatives to enter patient care areas or market directly to patients. Pharmaceutical representatives have to be accompanied by faculty and staff at all times. We also do not allow any giveaways during product demos, no free lunches, and we do not allow our physicians to actually engage in restaurant talks in which they market drugs or devices to fellow physicians on behalf of pharmaceutical companies. Apart from caring for our patients, we also educate future physicians and allied health professionals that will live and work in our communities. And to that end, we're sure that the medical school provides education to students and trainees about conflicts of interest through their scientific integrity and ethics coursework. We believe it's our responsibility to teach our future healthcare providers about the correlation between industry-provided gifts and provider-prescriber rates. It's important to note that these types of conflict of interest policies are becoming the norm nationwide. We are not the only academic medical center or health system in our area to embrace gift bans for physicians, and we believe that the policy will help lessen pharmaceutical company influence on physician prescribing behavior. Although our policy holds our own physicians to our conflict of interest policy and gift ban, many Temple Health patients who come to us with substance use disorders and opioid overdose injuries are treated by community providers who do not fall under our own conflict of interest policies. By creating this citywide gift ban, you create a uniform protection that will help lessen the impact that pharmaceutical manufacturer marketing may have on community physicians whose prescribing behavior may be influenced by pharmaceutical marketing. Thank you.
Thank you very much. Please state your name and begin your testimony.
Good morning, Chairwoman Bass and members of the committee. My name is David Grandy, G-R-A-N-D-E. I'm pleased to be here today to support Bill number 180888. I'm a physician and health policy researcher at the University of Pennsylvania and Penn's Leonard Davis Institute of Health Economics and have expertise on the issue of pharmaceutical marketing. Let me quickly get to the point. This bill, as you've heard, does three things. The first one is require pharmaceutical company sales representatives to register with the Department of Public Health. The second one is to share their promotional materials with the department. And the third is to prohibit companies from giving gifts to doctors to market their drugs. The first two are simple, common sense steps to increase transparency of what drugs are being marketed in our city and how they're being marketed. However, I'm going to focus my comments on that third element, which is gifts, and I have one message. Gifts should have no place in the relationship between doctors and pharmaceutical companies. This legislation would eliminate gifts, and my hope is that the committee will support it. I'm a primary care physician myself, and one of the most important aspects of medical care is trust. If you go to your doctor feeling sick or anxious about your health, the last thing you want on your mind is whether you can trust your doctor. When I recommend a treatment, my patients need to be able to trust that I'm acting in their best interest. However, when pharmaceutical companies market their products to doctors with gifts, even small gifts like meals, it can poison that trust. In prior research, I found that when patients believe their doctor is receiving gifts from pharmaceutical companies, they're twice as likely to report low trust in their own physician. Imagine for a moment if your doctor recommended a medication and when you walked out of the office, you passed a pharmaceutical salesperson on the way out, carrying in an office lunch with promotional materials for the medication you were just prescribed. It would at least make you wonder. Are patients right to be concerned? A large number of studies show that gifts, even small gifts, can influence decisions. The federal government collects data on gifts and payments to doctors. Several studies linking that data with actual physician prescribing records show that when drug companies provide free meals, physicians are more likely to prescribe the marketed drug. Eating a free lunch while listening to a pitch from a marketer changes what you take away from the pitch and how you feel about the product. And why does all of this matter? When marketing fuels inappropriate prescribing of new drugs, that can create cost and safety concerns. Marketed drugs are more expensive and there's less clinical experience with them. And that is not to say that new drugs are bad. It's just to say we need to be prescribing them only when it is appropriate. What has brought this issue front and center is the concern about aggressive marketing of addictive medications. And I can tell you my own personal experience when I started residency 18 years ago. At that time, drug companies were aggressively marketing new long-acting pain medications like OxyContin. And I remember hearing that we were not doing enough to treat pain. And while these drugs had a place for some patients, the messages from marketers were very one-sided, downplaying risk of abuse and touting better and safer pain control. In hindsight, the marketers did know more than they were telling. They saw the early warning signs of the risk of abuse, but continued to deliver a one-sided message to doctors. But it's not just medications like opioids. The same story was true for a medication you probably remember called Vioxx. It was a prescription medication, very similar to over-the-counter Advil, but a prescription medication nonetheless, that millions of people took unnecessarily that was fueled by aggressive marketing to doctors, only to find out later there were concerns about heart attack risks. And many of the patients that took Vioxx should have never been prescribed it and would not have been on it were it not for aggressive marketing to doctors. There is nothing wrong with pharmaceutical companies sharing information about drugs with doctors. A free and open conversation can be part of sharing new knowledge and information. However, there's no reason why gifts should be part of this interaction. Gifts cloud judgment and erode trust. And you may hear that doctors are highly trained and should be immune from the effects of gifts, but doctors are people too, and that is just not true, and the research backs this up. And you may also hear that industry self-regulation is enough, and that is also not true, as the industry's own guidelines allow the very meals that have been shown to influence decisions. And you have to ask yourself why they would be spending the money if the gifts didn't matter. Philadelphia can take a step forward today to protect public health by prohibiting gifts and creating more transparency around the information being delivered by marketers. And I strongly urge you to support this legislation. Thank you.
Thank you very much for your testimony, all three of you. I just have a question, and then we'll turn it over to the rest of the panel. I see that everybody's lit up. One of the arguments by the pharmaceutical industry is that doctors, in terms of scheduling time with doctors, that the only way to be able to get in front of a doctor is to offer free meals or something of that sort, which doesn't really make sense to me. And I'm wondering if you could, what is your opinion on that in terms of doctors at Temple and Penn and their scheduling? And I know that this is not a practice that is supported in those fine institutions, but it's really a hard to believe argument that I'm going to carve out time because you're providing me a free meal. And I'm just so overbooked, overscheduled. I just don't have time otherwise. So if you could address that.
So doctors need to eat lunch. they do eat at some point during the day. But it doesn't need to be provided by a pharmaceutical company. And if the information being provided by pharmaceutical sales representatives is valuable, then doctors will make time to hear it. If the only reason why doctors want to hear the marketing is because food is being provided, then perhaps we need to question whether the information being delivered is valuable.
I agree with his comments. We do have pharmaceutical representatives who make appointments and come and meet with physicians at Temple all the time. They are able to present their information. There's just not the opportunity to provide them with a meal or a gift.
And you still have representatives that come in on a regular basis. And, you know, Temple and Penn are some of the finest institutions, not just in the city of Philadelphia, but across the nation. And so this has not been a policy that has hindered you all being able to get information, your doctors being able to get information and to appropriately prescribe to their patients.
That's correct. I've never received a complaint from a physician.
Very good. Okay. Thank you very much. Bill?
Okay.
Councilman GREENLEE, excuse me.
Thank you, Madam Chair. And I think that raises an important point. And if I may say, your opening comments were well taken on everything. I do want to point out for the record, though, that one of the committee members, Councilman Derek Green, had informed us a while ago of a longstanding commitment dealing with the issue of autism that he has been very involved with. So and I know he cares very much about this issue.
Absolutely.
Just a few quick things, and it's more just kind of emphasizing some of the things you said. Dr. Johnson, I'm sorry. I'm glad you pointed out that this bill is just not about the opioid crisis. The opioid crisis obviously is something that's the impetus because it's right out there now, but there's the issue of addiction, and I think it's been pointed out in some of these, you know, it's been going on for a while with different drugs, and sometimes you don't know as you sit here today what will become a problem. Is that a fair statement? Or?
That's correct.
Okay.
And it's, again, as Dr. Grandy pointed out, it's not just drugs of addiction that are a problem. It's new drugs where safety, long-term safety issues may not be well known. So this is about making transparency in the marketing of all drugs.
And that's why it's important to have that information that you're asking for, which is an amendment. I think you give them 60 days to provide that information.
That's correct.
Yeah, because you want to know kind of you want to know what the future is holding, maybe. Right. Yeah. Okay.
Drug marketing information is actually looked at by the FDA at a federal level, but the problem is the FDA does not need to report to us what they are approving for Philadelphia. So this bill attempts to give some local insight and into control of what's going on in our city.
And there may be some issues raised about, does the department have the capacity to handle this? I mean, you're here, so I think I know the answer, but just for the record, you say, do you have any concern that the volume of information that might come in might be, you know, too much for you to handle? Could you talk about that?
No, well, first I have to thank you, because I love when council takes into account whether it's too big a workload for us to do. So thank you for that consideration. And this is a workload that we want. Okay. This is really something we feel strongly about. We do not think that this is a large volume of work, and I think it's something that we can easily handle. So thank you.
But how many, just an estimate, how much information do you think would come into you? Like, because I heard some estimate it could be millions of pages. That sounds a little over the top, but
you know, the fact that I can't answer that question is exactly why we need this bill. Is that we were trying to figure out how many pharmaceutical representatives were working in Philadelphia. No one can give us an answer. We can estimate. So that question about marketing materials is a little bit of an unknown because we have no idea what's going on in Philadelphia.
Okay. Thank you. I'm sorry, I'll be real quick. A couple more questions, if I may, Madam Chair. Just, again, there was a letter put in, and you address this, Dr. Johnson, again, on your testimony, that, I don't know, maybe the individual didn't really read the bill. It talks about that there shouldn't be pre-approval of any material given out. There's no pre-approval of the material in this bill.
Not by the local health department. There are pre-approvals that are done at a federal level, but not by us.
But this bill does not talk about pre-approval at all.
Not in this bill.
And it's obviously, as you state, not stopping any conversation that a doctor can have with a salesperson, right?
That is correct. It is, you know, we encourage exchange of educational materials.
No First Amendment problem here.
That's absolutely right. That all we want to stop are this.
And also, some issues have been raised previously about conventions, and there also will be amendments offered today that takes out these restrictions when representatives come in as part of a convention through the Visitors Bureau, or Convention and Visitors Bureau. Am I correct in that?
That is correct. We understand that conventions are important in Philadelphia and that we have no interest in impacting the conduct of convention business.
Okay. And real quick, Ms. Okendo, I see on you obviously have read the bill, and in your description of what Temple asked for, your regulations are even stronger than this bill, correct? And you tell people where they can be and all that kind of thing, correct?
That's correct.
And to repeat what the question the chairwoman asked, you've still been able to function, right? And people have been able to talk to each other, and there's been no problem with that,
There
right?
have been no problems, and we partner with pharmaceutical companies for other projects like grants. For
Maybe a little closer, Mike, just so we all can, just pull the mic a little closer.
Thank you. Yes, we have them come in and exchange information freely with our physicians, and we partner with pharmaceutical companies for things like grants for our continuing medical education programs. It hasn't hindered our cooperation or our partnership with industry. Just
Okay.
have to follow the rules of the campus.
Okay, great. And finally, Dr. Grandy, you mentioned, I think, a key word in your testimony. You say patients are twice as likely to report low trust in their doctor. And I would guess trust in your doctor is a pretty important thing. And that's probably one of the reasons you have these regulations that you do, which we're trying to put in with the city. Is that right?
Yeah, I mean, trust is really at the foundation of every doctor-patient relationship. People come to their doctor at a time of vulnerability, anxiety, sickness, and it is not the time to be needing to go out and second guess, second check every single decision that your doctor is making on your behalf or recommending to you. And so it's really essential.
I'm sorry. And that brings in the issue of perception, because I think there's reality that there has been pointed out in the testimony that the number of gifts and the number of prescriptions correlate in a lot of ways. But there's also this perception of both the patient themselves and also the perception of the general public. Is that a fair statement?
Yeah,
the perception that if these gifts are being given out, maybe there's something not quite right here. Is that?
Yeah, I think that when you just look at the situation, I think any patient consumer out there would question why this exchange is happening. It wouldn't make sense to most patients about why we should allow that to happen.
Gotcha. Okay, thank you. Thank you, Madam Chair. Sorry, it took a little while there.
That's fine. That's fine. Councilwoman Blondell Reynolds Brown, and then Councilwoman Maria Quiñones-Sánchez, and then Councilman Al Talkenberger.
Good morning.
Councilwoman.
Good morning. Thank you, Madam Chair.
Good
Councilman Bill Greenlee was reading from my notes because he posed a number of questions that I wanted to ask as well, so I need to make sure I heard what I think I heard. Are you saying that there's no current registry for pharmaceutical sales reps that's maintained any place in the city of Philadelphia? Is that what I heard?
That is correct. There is no current registry or knowledge of the pharmaceutical reps.
Okay. And this bill will allow for that new practice?
That is correct.
You also mentioned that other municipalities currently have this measure underway. Can you cite a couple just from the homework that you're aware of?
I believe it's Chicago has,
Okay.
I don't believe anybody has a bill exactly like
No.
ours,
Seldom are
but
they-
Chicago and Washington, D.C. have some registrations
Measures.
for pharmaceutical reps.
Okay.
Correct.
And then I too ask about capacity always, because too often I hear when we introduce measures, we hear from departments, oh, we don't have the capacity, particularly around lead. That'll be another health department challenge that we'll have next year. So you anticipate receiving these marketing materials, and then walk us through what you believe the next steps will be once you get those materials. And let's look at the worst case scenario.
So I imagine that we, of course, will try to be paperless as most as we can. So we will digitize as much of the material as we can. We'll catalog it into categories. For example, controlled substances like narcotics and opioid and those related drugs would probably be categorized together to see what's being marketed for those. Antibiotics may be bunched together. So my sense is that a lot of this will be that we'll have to organize the materials, and then there will be some local review of this Not that we can change the
Sure.
materials, but it is to understand, well, these are the drugs that are out there, and this is what's being said. And if we see a problem, then we might, actually, the first call might be to the FDA as opposed to the pharmaceutical company. But, you know, there are a number of physicians in the department, and I think we have the expertise to do the work.
Okay. I've raised a question offline with the sponsor of the bill and with the administration around coupons, because seniors rely on coupons. Working people rely on coupons. So for the record, state where we are now with regards to use of coupons.
Absolutely. So just in case anyone doesn't know what the coupons are, is that many times coupons will come from the pharmaceutical company or from, you know, could be from the drugstore or an insurance company, might provide a coupon that will give a discount on specific drugs. And the bill is prohibiting only coupons that apply to controlled substances, which means narcotics.
Sure.
So that is the only, we're not restricting if somebody wants to give a coupon for a discount on an antihypertensive medication. There are no restrictions on that. Its restrictions are only for controlled substances. And there is one exception that was added when it was brought to our attention that the medications to treat opioid addiction, such as Suboxone, which is one that I think you've all heard about now, that there is an exception that allows coupons that provide for those controlled substances that treat addiction to be permitted.
And what about seniors who need controlled substances?
So seniors who need controlled substances, they are not an exception right now. That it is not, but Medicare does not allow you to get a coupon, so that it's not really applicable in that setting.
Okay, that's helpful, because anything that's going to in any way remotely, directly or indirectly harm seniors, I'm not for it ever.
Got it.
Okay, please.
Yeah, I would just reiterate that point. All federal programs, so Medicaid getting funding from the federal government as well as Medicare, prohibits coupon.
And what about seniors who are not on either one of those programs?
So if a senior had not yet opted
Signed
into
up?
Medicare, then it would apply to them.
Okay, all right then. Speak to me, if you will, on the protecting Philadelphia from aggressive marketing of prescription drugs. What is a black box warning? Serious side effects are rarely mentioned in pharmaceutical promotions, even for drugs that have an FDA, quote, black box warning. What is that?
Well, a black box warning has to do with adverse events, serious adverse events that have come up for a pharmaceutical product. But I think Dr. Grandy is more closer to a practicing physician than I.
So these often arise when the FDA identifies a new concern about the safety of a medication, and they'll simply add a warning label equivalent to that medication.
I see.
Yeah.
Okay. And then lastly, a lot of attention is, well, some would say the attention towards opioids has been intentional in that way. And for drugs going forward that may end up in the addictive category. The sponsor of the bill has shared with me the reasoning on why we're casting the net wide. What is your view or perspective on that when we're principally concerned about addictive drugs now, tomorrow, and forever, and or opioid drugs, which, quite frankly, we're still trying to figure out how we can get our arms around?
Well, I'll start. We probably all can answer this question a little bit. So I think you're really asking, we're using opioids as the example of why this bill is so important. But it really is just an example. You know, the problem is this lack of transparency of the relationship between pharmaceutical representatives and the physicians and what that exchange is. So right now, it is, there's no control over the giving of gifts and the influencing of opinions about all kinds of drugs. And, you know, if it were, you know, in this city, Diabetes, for example, is a very, very common problem, and there are lots of medications that are prescribed for diabetes. It would be equally unacceptable to me to have a pharmaceutical representative giving misleading information about a drug to treat diabetes. It may not end up in addiction and homelessness, but still it's a misleading and a closed interaction that we want to try to prevent.
Okay, and then lastly, I believe in mapping and how data can drive policy decisions. Does mapping have any role in this legislation, or is it too premature? Because I'm curious to know if the violations in the way that we have come to understand them are more prevalent in certain parts of the city than others. Is it too premature to get a handle on what sections of the city are more egregious, if you will, and the practices that this bill addresses?
Well, it probably is a little premature to do that. We know some of our partners have came forward in support of this bill, the big universities, but we really don't know what's going on across the city. I am positive that there are many private practices in this city that have similar policies to this, that they do not allow accepting of gifts or unwarranted marketing efforts. But we don't know who they are because, again, there's just no registration, there's no control on the process. So there's no way for me to say that these institutions are doing it better than those institutions.
Got it.
Because we don't know what those other institutions are actually doing.
Sir, you want to come in as well?
Yeah, I would just say that I think in my mind the prohibition on gifts is very straightforward in terms of how we want to clean up these relationships. I think this part about a registry, right now, we wait to see when problems emerge, spikes in prescribing of something, and I think what we always want in public health is early indicators that we can then act on. And I think putting the department in a position to say, maybe in one part of the city we're seeing a spike in the marketing of a particular medicine. Why might that be? What are the concerns that would raise? It may not justify doing something about it immediately, but it gives you some early signs that maybe we need to heighten our attention to this particular health issue, this particular medication.
And that may indeed be an opportunity if we want to not end up with another crisis from crack to opioids and a different kind of crisis X number of years from now. So the American Medical Association will keep the registry of physicians, correct? So there's a Philadelphia chapter that keeps a registry of physicians in the city. I'm awestruck by the fact that we don't have a registry of pharmaceutical reps.
Yeah, so the American Medical Association tries to keep a national database of all practicing physicians. It's not perfect, but they do try to maintain that database. And
so is that, then can one safely assume then that there's no professional organization that captures the attention of those in the pharmaceutical rep industry?
Certainly not a public database that I'm aware of, and I doubt there is such one that exists.
Okay then. Thank you all for your testimony. Thank you, Madam Chair.
Thank you, Council Lady. Councilwoman Sanchez.
Thank you. Good afternoon, and thank you for your work on this. I appreciate Councilwoman Bass and Councilman GREENLEE taking the lead on this. People assume that because I represent Kensington, the epicenter of the opioid addiction, that this is not a citywide problem. So I appreciate when we have broader discussions around this. I hate to be the target all the time. I do have a question for the health department. You know, we always get criticized when we try to legislate. I hate when industry comes in and tells me I can't legislate because I run to legislate. So I always have this debate when I'm getting lobbied. It's like, don't tell me what I cannot do. Because a bunch of people vote for me to do this stuff. But I am interested to know, what is it that we do with the doctors on our payroll and funded by the health department right now as it relates to their relationship to the pharmaceutical industry?
So the health department, we follow the mayor's executive order, which prohibits acceptance of gifts. It's not anything specific at all to the pharmaceutical industry, but about a decade ago there was a an executive order that bans acceptance of gifts. I'm sure you're aware of the executive order, and that is the policy by which we have stood. It's a policy I personally follow. I'm sure my commissioner does, although I don't mean to speak for him. It does not, we've never done anything with registering pharmaceutical representatives or have asked any of them for marketing within our premises. This would be a new thing that we would have to implement as well, but there is no intention at all to carve out the health department as being exempt from any of these regulations. We expect to abide by everything as written.
Yeah, let me encourage us to be more proactive than that and establish some protocols, because the one area where I do think it's important is let's not ask the private sector to do what we're not willing to do internally, right? And so there's a lot of doctors on our payroll, and we need to make sure that they are, if we need, again, this is all new territory, right? As we are doing this, that we do this internally, right? So that when the private sector says this is too complicated, we can say, no, we do it internally. We manage so many doctors, and we have a lot of part-time physicians in our payroll, you know, who also work for the other industry and do some time in the city. So I think it's important. And that helps shape, right? Because it's very quick to tell people what they can't do, not always as proactive to tell people what we should be doing in an ethical and standard way. So let me encourage the health department to do that. I have a question around cannabis, since medical cannabis is kind of new, and how this, particularly as it relates to coupons, just because medical cannabis is only a cash business, and we do have people who are turning to cannabis to deal with opioid addiction and other stuff, so.
What I can say about medical cannabis is it's not a prescription medication.
Right.
It is this, you have to fall into one of the categories to be eligible, and you have to get an authorization and a card. But I don't see that it would be subject to any of this regulation. That's not to say that I don't think it should be regulated. I'm not saying that, but because it is not a prescription drug, it is not covered under here. Is that what my panel agree? I guess we're kind of shrugging here, is that it hasn't come up, but I do not think it's covered.
Yeah, so let me encourage us to look at that, right? Because I know that the pharmaceutical industry is now getting into the cannabis business, right? And they spend quite a bit of time on this discussion of everything, you know, opioids to MAT. I'm not, as you know, I'm not a fan of one opioid to another opioid, and that's why this whole cannabis piece interests me about how this all falls into place with this. So from your understanding from all of you, folks who have medical cannabis are on a treatment plan from someone, because they have to get approved, right? And by who, right? That's why I'm kind of.
I'm sorry, say.
Medical cannabis has to be approved by a doctor.
That is correct. It has to be by a doctor who has been registered with the state and approved by the state to do that.
Okay.
Not prescribe, but to.
Point of information, that would only be for cannabis, correct? Or not? What you just said?
Yes.
Okay.
Yes,
okay.
I believe.
Thank you.
Yeah.
Thank you.
Okay. Yeah, so again, I'm going to encourage the administration to give us some guidance. I just want to be sure that, again, because, you know, this is a new area, I want to make sure as people utilize cannabis, how that all plays in. In terms of the registry, we have a registry of doctors and medication. What, if anything, in terms of data sets, as we develop this pharmaceutical rep stuff, how do you see proactively using this information as it relates to patterns, as the Councilwoman was saying, around mapping? And the reason I say that is because the DEA shares with my office a lot of information around pharmacy and opioid sales of pharmacies, and I have some of the highest opioid sales pharmacies in the country in the 7th Councilmatic District, so there's a relationship there, and one of the works, how we've been able to work around the bad actors and the bad doctors has been some of the data gathered by the DEA. Is there any other utilization that you foresee once we have this registry for the department?
So I think we do have access to some of the prescribing data that you're talking about through some of the Medicaid databases and through some of the private insurers will share data with us, although generally the data is not name-based for the patient. It will be provider-based.
Right.
So we do have an ability to take a look at the way prescribing patterns are occurring across the city and based on what populations they may be serving as well. So I think in the future, our plan would be to try to match up that data to see what the marketing is doing, what the pharmaceutical representative marketing is doing, what it's saying, where it's going, against what may be showing up in some of these major databases about prescribing patterns. And I think if we find I'll say aberrations, or we find that a drug is being prescribed more than we believe should be acceptable, we probably would investigate, at least inquire of the providers what's going on.
Thank you. Again, anything that adds to transparency, you know, I always find very difficult when people are against us being more transparent about what we're doing. And if you're going to conduct business in the city of Philadelphia and we're city government, we should have access to the information. And so, thank you very much. Thank you.
Thank you, Councilwoman. Councilman Toggenburger.
Madam Chair, thank you very much. Dr. Johnson, it is my understanding that under the Sunshine Act, pharmaceutical manufacturers are required to report all gifts and payments to physicians at this moment.
Yes, there's an open database that reports on a national level these gifts to individual physicians. That is correct.
Why we have access to that as a city?
We can get access to some of that information.
So in some ways, that work is being done already.
Yes, but we're trying to prohibit the gifts. This is just a catalog of the gifts.
That is my next question. What is a definition of a gift? Is it a Mercedes-Benz? Is it a trip to Hawaii?
It would be.
It could be, okay.
Yeah. No, we would not encourage anyone giving.
I understand. I mean, that's a sizable gift to try to sway someone.
Right.
That's might be closer to the definition of bribery. I got it.
Yeah.
How about lunches? Where does that end with lunches? I mean, I think, and I've been a salesman in many ways and for a long time, different products. Chamber of Commerce memberships being one of them. But a lunch is also a convenient way of getting together with someone because as human beings, unless you run on a different mechanism of metabolism, everybody has to eat at some point. It's sort of nice. What would your feeling be if there was a limit on that lunch? I mean, I can't believe that a physician would go against his own, would be swayed by a $10 hoagie or something like that. Small amount, minimal. Be interested in hearing what you have to say. I mean, did they change their entire practice because someone came in with a Wawa hoagie or a Fink's hoagie or some sort of hoagie?
So there is research that shows even small gifts do influence decision making.
Really?
Yeah, absolutely. So this graph right here.
You're going to put all the restaurants in this city out of business.
This graph right here, I know you can't see it, but it goes up, right? And the reason it goes up is because as doctors get more meals, their prescribing of the marketed drug goes up. And these are just lunches.
Do I have that? I guess I do.
No, I just.
Oh, I would like to see that. I mean, sure. I can't believe that a woman or a man who's making over $200,000 a year is going to make a medical decision over a hoagie. That's $10.
But, you know, I think it's a mistake to think about this as, you know, some sort of bribery transaction where someone is saying, I will give you this in exchange for you prescribing my medication. But when someone is feeding you and they're delivering a marketing message to you, it makes you more receptive to those messages.
I think you may have some opinions on it. I have some other opinions on it, but I'd like to see your data. I would have to say, though, in my eyes, what you're buying, if you're buying anything at all, is the person's time. In the sense that, look, you got to eat, I got to eat, why don't we eat together? I mean, unless they're bringing in things from, Barclays Prime Rib, I get that. That's a little over the top, or, Capital Grill, that's over the top, but a McDonald's hamburger or a Wawa hoagie or something in that nature where it's a small amount of dollars just to sit and eat and talk to someone about a product, I don't see the relevancy of that. Without getting government very intrusive.
Yeah. I know it doesn't seem intuitive, but the research shows that small gifts influence decision-making. It's true for doctors, it's true for non-physicians as well. It's the very reason why when you receive little fundraising things in the mail that have free mailing labels inside, it makes people more likely to donate money because they've received a gift and they want to do something in return.
They might. I mean, okay. I mean, the other question I have is a number of, when you're talking specifically opioids, at this point, they're generic drugs. I mean, for example, morphine, codeine, opium itself, they're manufactured by a host of manufacturers, I believe. Correct me if I'm wrong.
Yeah, many of those products are now, not all, but many are.
I don't think there's any, I mean, where I believe a drug salesperson is making, lead would be with something that is not generic at this point. Use our product because it's better. I think in those cases, OxyContin, yes, has been abused, but is still on that list. And fentanyl, I believe, is still. They're not generic drugs, is my understanding.
You're saying they're not generic drugs, or they are generic?
I don't think they are. Are they? I mean, I don't know. I don't deal with this on a daily basis. You tell me.
Yeah, those drugs are available generic now. There are some pain medications that are not available in generic. Or
my point to you is, if we're trying to stop the opioid problem, this is not really looking at the picture, because they're generic drugs which any salesman could have, and it doesn't matter, I don't think. I mean, when I think a salesman makes the difference, or a saleswoman, it makes a difference if it's a drug that is specific to a particular company, and they're the only ones that make it. And we'd like you to try this because, and once again, giving a big gift, a trip to Hawaii or someplace, that, yeah, I got a problem with that. But I have less of a problem, or no problem at all, if it's really just a minimal lunch, because you need to eat, I need to eat, let's eat together. I mean, I think that's how this practice started. I don't think it actually started because of anyone trying to be mean-spirited or get a leg up on someone. It was basically, I'm taking you to lunch, not taking you to lunch. You're going to eat in your office, and I'm coming with a hoagie. I just don't see the reason that has to be reported. In fact, I would be in favor of banning any kind of gifts in a large way. It makes some sense, but some of this doesn't make much sense to me because it's minimal. I can't, that a doctor, man or woman, would put their reputation on the line over a hoagie. I don't think that makes any sense anywhere. I don't think that's done. It's my opinion.
I appreciate your opinion. I think that the research raises concerns about whether influence is happening there, and I think the balance of the evidence says that yes, there is influence, whether doctors or patients necessarily realize it at the moment.
Okay. The other question I have is it possible then, with the data that we have, that we could find out what pharmacies are actually prescribing an overabundance of opioids? Is that possible? With the data that we have from the federal government?
There is something known as the PDMP, which is run by the state, and at present we can get aggregated types of data, but it's very limited. We're in the process of trying to negotiate greater access to that type of data.
Okay. You think you'll be successful, or?
I don't know. The PDMP is really driven by, it's a data system that was created so that every time a physician is about to prescribe an opioid, they are now required to look up and see if that patient has been getting lots of opioid prescriptions.
I
Pharmacies are also supposed to be looking at patients to do this.
I think that makes sense.
Yes, so it is a new tool in our state. How we're going to be able to use it, how much data we'll be able to get locally, I think is still in the works.
I've talked to a number of people, a number of doctors. Now, you correct me if you think I'm wrong or the information I'm about to give is wrong. But a lot of the patient-doctor relationship that happens in this country is at the end of the appointment when someone is feeling bad. They are going to ask, or they are expecting a prescription of some sort, generally, to cover their pain or to cover their ailment or make them better. I think that is required in 95%. I might be wrong on that, but the vast majority, let me retract it and say the vast majority of doctor-patient relationships, that the patient is expecting some sort of prescription to help their ailment, whatever that may be.
So are you asking?
I'm asking you. You're a doctor. I'm not a doctor.
I would agree that many patients come in with the expectation of getting a prescription. And I just want to point out, the bill doesn't have anything to do with that. We really are not trying to put ourselves between the patient and their physician. That interaction is sacred to me as a physician. What this bill is about is putting the intrusion between the pharmaceutical rep and the doctor. It's the giving of the gifts, it's the influencing of what that physician ultimately might recommend to the patient. So we are really trying to strengthen the patient-provider relationship by putting the trust back in that Dr. Grandy was talking about.
Okay, I think trust is very, very important. All right, thank you very much. Madam Chair, thank you.
Thank you, Councilman. Can we have the clerk call the next panel? Thank you very much for your testimony. Can we have the clerk call the next panel?
Bonnie Grant, Executive Director, Philadelphia Life Sciences, Philadelphia Convention Visitors Bureau. Angela Kochenauer, Eastern Director, State Government Affairs, the Biotechnology Innovation Organization. Sharon Brigner, Deputy Vice President of State Policy, Pharma. And Chris Molyneux, President and CEO, Life Sciences, Pennsylvania.
Yeah, they can, either or, doesn't matter. Point of information, Madam Chair.
Yes, Councilman Greenlee.
Just very quickly, I just want the witnesses to know, particularly Ms. Grant, you know, we are offering amendment at the meeting that takes the issue of conventions out of the bill. Are you aware of that?
I am aware of that.
Okay, thank you. Thank you.
Okay. All right, well then why don't we start with you if you want to state your name for the testimony and begin. Ms. Grant, I think you were first up.
Should we say?
I think.
Bonnie Grant was the first name called, but whatever order you all want to go in.
Okay.
Somebody start.
I think I might start, Chairwoman Bass. Thank you, and members of the Public Health and Human Services Committee. I'm Chris Molyneux, President and CEO of Life Sciences Pennsylvania. Thank you for allowing me to testify today on Bill number 18888, an ordinance entitled Pharmaceutical Sales and Marketing Practices. As we all know too well, the opioid epidemic is one of the worst public health crises the city of Philadelphia, the Commonwealth of Pennsylvania, and our country have faced in the past century. Its effects are far-reaching and community agnostic. In fact, I'm sure every one of us in this room has personally felt the consequences of this ongoing emergency. I want to make it clear from the outset that the life sciences community of Pennsylvania is committed to doing everything in its power to curb this tragic epidemic. And as a public advocacy organization, this issue has been one of our top priorities for several years in discussions with legislators at the state and federal levels. My colleague, Ms. Bregner, will speak in a few moments about how we as a community and how we as a society have reached this crisis. I'd like to provide a local life sciences perspective on this ordinance. As a statewide trade association, Life Sciences Pennsylvania represents more than 800 member organizations including small biotech companies, pharmaceutical manufacturers, academic research institutions, medical device makers, patient advocacy organizations, and myriad service providers related to the development of groundbreaking therapies and cures. I'm pleased to report a number of our member companies are working on novel, non-opioid medications to treat chronic and acute pain, as well as tamper-resistant delivery modalities for these medicines. In fact, one of our top advocacy priorities at the federal level is robust funding from the Federal National Institutes of Health, the NIH, of which the Commonwealth has 2 top 5 recipients, the University of Pennsylvania and the University of Pittsburgh. Earlier this year, in the bipartisan budget agreement that was passed by Congress, an additional $500 million was set aside to support ongoing and new research to address the opioid crisis. Given Philadelphia's vast intellectual capital and entrepreneurial spirit, I would like to note that this is one place where the city and the life sciences community can work together to ensure Pennsylvania, and Philadelphia in particular, is the place where this crisis meets its demise. However, we have significant concerns about how this ordinance was drafted without any consultation with our region's diverse life sciences community. This ordinance could have a negative effect on the perception of Philadelphia as a life sciences hub, discourage connections that are made here between researchers, scientists, and healthcare providers, and most important, have unintended consequences for patients, all while doing nothing to actually reverse the opioid abuse epidemic. As Dr. Johnson acknowledged in her testimony in the first panel, and I'll read, it was not, she did not say this was not only about the opioid crisis. She very specifically said, but this bill is not about managing the opioid crisis. It is about preventing the next drug crisis. I'm here to ask the committee to delay a vote on this ordinance until subject matter experts from the healthcare community and from the developers and manufacturers of medicines have the opportunity to express their perspectives and have meaningful solutions considered. There are approximately 190 life sciences organizations that call Philadelphia home, and according to a 2016 Greater Philadelphia Regional Life Sciences report, more than 4,200 individuals are directly employed by life sciences entities in the city. Policies like the one proposed paint the industry with a broad brush, require onerous and unnecessary licensure requirements, especially for our small and emerging biopharmaceutical companies, and could further inhibit growth in the life sciences sector. Additionally, this ordinance can hamper the interaction between researchers, pharmaceutical and medical science liaisons, and healthcare providers, either by lessening the likelihood those individuals will come to Philadelphia for conventions and conferences, or through a ban on something seemingly trivial like modest meals, which could interfere with these communications. I had to take note of the councilman's comments about the meals and the assistant professor from Penn's comments about the influence of a lunch on a physician's prescribing behavior. The point about trust really just does not fit in that. I have to believe that physicians base their prescribing behaviors on what's right for the patient, not on a sandwich. Thank you for that, Mr. Councilman. Healthcare providers use exchanges with pharmaceutical manufacturers to gain valuable, up-to-date medical information about a medicine's risks and benefits. Given the intense time constraints under which doctors operate, meeting over a cup of coffee, breakfast, or a lunch can sometimes be the only time in which a physician or other healthcare practitioners can carve out time to meet with a representative from the developer and manufacturer of important medicines. These aren't just salesmen, these are experts in the medicines that the doctors are prescribing. Furthermore, the provision that requires manufacturers to submit all written materials to the Department of Health is of great concern to our members, and something we have heard about from several companies. And the ordinance does specifically say, copies of all written materials describing or concerning health drugs prior to distributing any such materials to healthcare practitioners. All the companies...
Point of information.
Councilman Greenlee?
There'll be an amendment produced at the meeting that makes that 60 days afterwards. So that is being amended out. Thank you.
Thank you. And as was acknowledged, all these company materials are already reviewed by the FDA. And while I appreciate Dr. Johnson's comments about the resources of the Department of Health, I can assure you this is a job the FDA, with an annual budget of $5 billion, takes very seriously, and it's unclear how the city may determine what further healthcare provider training is required simply by reviewing sales materials that have already been scrutinized. Along the same lines, the life sciences industry is committed to following the highest ethical standards and complying with laws at all levels of government. There is extensive compliance to ensure companies are operating in good faith under the federal anti-kickback statute, the Federal Sunshine Act, and the Health and Human Services Office of Inspector General's Federal Compliance Program for Pharmaceutical Manufacturers. While marketing practices have certainly come under scrutiny in decades past in response to some very bad actors, we would all acknowledge that, the industry, working closely with officials at the federal level, has made it a priority to proactively comply with all applicable federal health programs or risk being severely prosecuted by the U.S. Department of Justice. Given all the requirements that this ordinance puts forth, it's concerning that Section 6-1204, which gives the Board of Health open-ended authority to promulgate further regulations as they deem necessary, was also included in this proposal. While we recognize that the Board of Health must have some flexibility in its ability to put forth regulations, it is concerning that such a broad ordinance would give the board further unlocked authorization and independence from City Council oversight. As our concerns on many aspects of this ordinance have been made clear, it must be noted that should legislation be enacted, the 90-day effective date is simply impractical. That's in the current ordinance. Even for our largest member companies, this is an expedited time frame and one our small to medium-sized companies will find particularly difficult to achieve. But this ordinance affects more than the interaction between physicians and the developers of the medicines they prescribe. The prohibition on manufacturer co-pay assistance coupons on all controlled substances could be financially harmful to patients. As health insurers and pharmacy benefit managers have shifted more cost responsibility to patients, even small changes to cost-sharing requirements like this prohibition can adversely affect patient adherence and lead to increased health costs when a disease is not managed appropriately. These coupons are not gifts to physicians. They are an example of valuable assistance programs that help patients with their costs so that they can afford their medications. We have concerns that this kind of ban could affect the way in which patients suffering from addiction have access even to medically assisted treatments, colloquially known as MATs, or whether patients with certain mental and behavioral health disorders have access to treatments that may be deemed controlled substances. Clearly, the unintended consequences for patients is exactly the kind of development we want to avoid, and it's why we're here today. Philadelphia is home to a life sciences community that has been at the forefront of medical breakthroughs for centuries. Most recently, the first cell therapy to essentially cure a type of cancer was developed here at Penn and first approved by the FDA. And the first FDA-approved gene therapy that may prove to be a cure for a certain type of blindness was also developed here in Philadelphia at Children's Hospital and now a company called Spark Therapeutics. We have no doubt that if elected officials, physicians, industry experts, researchers, scientists, and all those others dealing with the opioid crisis can work together on a policy solution, benefiting from each other's expertise, we can assure Philadelphia is a leader in reversing this tragic health crisis. I thank you again for the opportunity to testify.
Thank you for your testimony, and if you want to state your name for the record and begin. And we'll take the condensed version.
Thank you, Madam Chairwoman.
Sure.
Thank you, members of the council. Thank you for allowing me to have the opportunity to testify before the Philadelphia City Council Committee. My name is Sharon Brigner. I'm a registered nurse by training, licensed to work in both Texas and in Virginia. I recently worked into the emergency rooms in Northern Virginia where I live, a weekend shift every weekend just to keep my hands into the clinical care. I also worked previously in hospice nursing in both a facility and home-based care. I'm very familiar with pain management and the patients that need medications in order to live their lives. I now work as Deputy Vice President at Pharma, the Pharmaceutical Research and Manufacturers of America that represent 30 of our leading biopharmaceutical companies. And our companies are devoted to discovering new medicines that help patients live longer. Since 2000, pharma member companies invested more than $600 billion in research for new treatments and cures, and an estimated $51.2 billion in 2014 alone. We have really promising research that offers new treatments and promising treatments on the horizons. In fact, we have 40 new medicines in the pipeline to treat those who are currently addicted to opioids, and yet another 40 new medicines in the pipeline that are non-opioid alternatives, which is a nice alternative because not everyone needs an opioid, and these are important pipeline medications. We have absolute great sensitivity to the crisis that's happening here in the city of Philadelphia with this opioid epidemic. My industry wants to be a real part of the solution and shape this ordinance that can help effectively deal with the unnecessary deaths and devastation that people who are addicted to opioids are suffering and those who are abusing medicines here in the city. We make products that save lives and improve lives, but we recognize that when abused and misused, it can result in deaths like the 1,200 deaths seen every year here in Philadelphia. However, Pharma feels strongly that this ordinance, while well-intended, does little, if anything, to address the opioid epidemic. We stand ready to be part of that solution along with other stakeholders, and we want to be part of this ordinance that provides policy tools to help create meaningful change. It's important to step back and look at how we got here with this epidemic. There are many contributing factors that thankfully no longer exist, but I want to raise those to give some context, because several years ago with the approval of opioids, the FDA was in its infancy, approving products as quickly as 30 to 60 days. Now we have products that go from bench to bedside that take 10 to 12 years, or the 3 lengthy phases of clinical trials to ensure efficacy and safety of our medicines. In addition, hospitals were being reimbursed based on pain scales. So patients were saying, how was my pain managed in the hospital? And if it was managed well, they would give a favorable rating, and therefore the hospital would get better reimbursement rates. Also, medications that are highly effective in treating pain were more addictive than previously understood, and patients did become quickly addicted. There was no plan of care with the healthcare provider and the patient to wean that patient off of medications, and the alternative strategies and products that we have now were not as available. Now we have those products, but for those who think that this ordinance is our magic bullet, it is not, and it does little to impact the opioid epidemic and help patients in Philadelphia. I have 4 brief points to talk about. One, which is this ordinance does limit coupons as written. It misconstrues them as a gift to a healthcare provider, when really coupons are there to help a patient who cannot afford treatments to important therapies that might help them in their condition. This ordinance would hurt patients, particularly those who are already addicted and rely upon medication-assisted treatments like buprenorphine and Suboxone to get off of their medicines. To rebut inaccurate testimony provided earlier in panel 1, the medication-assisted therapies are included as written, as the ordinance is written. So the fact that they're exempted is not accurate. Pharma feels that this is a barrier between patients and providers, again, needing to rebut that important point that was made, an inaccurate point in panel 1. Number 2, the ordinance is misguided by requiring manufacturers to submit their marketing materials to the city, because our manufacturers already do this. We submit educational and training and marketing materials to the FDA. Ordinance is unnecessary and duplicative and would use additional resources and expenditures of the city that could be spent elsewhere, and manufacturers already abide by this FDA requirement. Third, this ordinance creates a meal ban, which prevents manufacturers from providing a meal while conducting an educational briefing. This is a critical tool for manufacturers to provide important information to the entire clinical staff. As I said, I'm a nurse. A lot of these educational briefings are not just intended for the physician or the prescriber, but for the nurse who's actually giving and administering those medications or teaching the patients how to appropriately use their medications and adhere to those medicines so they can have better outcomes and lower healthcare costs. So meals that are most likely, as a council member said a hoagie or a bagel or a boxed lunch or a salad or pizza, it does afford the healthcare provider and the staff, who sees on average one patient per every 7 minutes, with a simple break in their day to sit, to listen to the information, the benefits and the risks of the products, the uses for old products, new uses that are now approved for old products, because they do not have the time to sit there, to read clinical journals, to network with colleagues, and get the latest and greatest in data. They have a very busy day. By implementing this meal ban, the ordinance would do a real disservice to our healthcare providers, which ultimately does hurt the patient who may not get that best treatment option for their condition if the provider is unaware of the new innovative treatment option. Fourth, we believe that Section 6-1204 of the ordinance is overly broad and vague and causes great concern with our industry. If it passes as written, the city could create any regulation that it wanted. Mr. Molyneux already addressed much of that, so I'm going to move to my final point, which is that this ordinance, if it were to pass, would mean that our companies must have additional time than what is currently provided in that ordinance. We'd ask to extend the days from 90 days to 180 days or more to ensure that the companies could comply. Again, these unnecessary requirements take away time that our companies need to devote to research and development, to new cures, opioid alternatives, addiction treatments. Our mission, the pharmaceutical industry's mission, is to develop innovative products. And while this ordinance is well intended, there are proven best practices that the city would incorporate that could better adopt and better address the opioid crisis, like 7-day prescription limit for opioids, or mandatory use of the prescription drug monitoring program, the PDMP, that reduces misuse and abuse without taking time and resources away from innovation. And finally, I just wanted to mention another inaccuracy just for Councilwoman Sanchez, who had asked about the CBD. CBD oil has been approved with one of our medications. It's Epidiolex, which treats 2 rare forms of epilepsy. So I just wanted to make sure that Councilwoman Sanchez was aware that this oil has been approved. It would be considered a controlled substance in Lumpkin. Thank you for your time and attention. I really appreciate it.
Good afternoon. My name is Bonnie Grant. I am the Executive Director of PHL Life
Point
Sciences.
of information again.
Which is
Sorry.
Councilman Greenlee.
On the time frame, again, a amendment's going to be put in at the meeting to extend the effective date for 100 to 180 days.
At PHL Life Sciences, as part of the Philadelphia Convention and Visitors Bureau, we work to promote Philadelphia as a thriving life sciences hub and a destination for meetings in life sciences, both large and small. And certainly we know the opioid crisis has negatively impacted the lives of our residents, and we want to join you in finding a solution. The tourism industry has been directly impacted by this crisis. We know the rise in homelessness is in large part due to the opioid epidemic, and many of our potential customers and convention attendees express concern with the number of homeless on the streets. As an industry, we have taken action and joined the city's efforts to develop creative solutions to these issues, and currently our president, Julie Coker-Graham, serves as the co-chair for the Mayor's Shared Public Spaces Working Group, which brings together business and nonprofit leaders to create solutions that will stop this cycle of homelessness. It's the working group's goal to make homelessness rare, brief, and non-recurring by addressing the root causes, and for many, that is opioid addiction. And we certainly commend City Council on taking the very necessary steps to fight the growing epidemic, and we hope you will consider all options before proceeding with this bill. The proposed legislation could profoundly negatively impact the local tourism industry. In 2017, we brought 119 life sciences related events to Philadelphia that brought 162,000 visitors to the city, consuming 123,000 hotel room nights. These visitors generated over $9 million in state and local taxes, had an overall economic impact of $96 million in Philadelphia. Pharma-related meetings, both large and smalls, in hotels and the convention center, make up a large percentage of these events, which provide opportunities for the work to be provided for 73,000 hospitality jobs in the city. Hospitality and tourism is now Philadelphia's second largest employment sector, second only to education. And looking ahead to future years, the life sciences related events and meetings on the books are estimated to generate an impact of $1.7 billion for Philadelphia. These events provide significant job security to local hospitality workers, including the residents who live in every neighborhood throughout this county. This ordinance would have a significant negative impact on our ability to both keep and secure future biomedical convention business. Even if the ordinance exempts activities occurring on the convention floor, the overall perception that our city is not friendly to the pharma industry will make us less competitive and could hamper our ability to secure and retain future business. Some currently booked conventions have already expressed deep concern that their leadership and members will encourage organizers to consider other cities as the convention destination if this legislation passes. All associations have advocacy platforms and carefully watch legislation in destinations that are contenders for future convention business. And when legislation is counterproductive to an association's legislative agenda, it is most certainly taken into consideration when deciding which destination to choose for their next meeting. And we would never condone the use of travel as a weapon. In other instances, we have seen associations make destination decisions for their meetings and conventions based on local legislation. Today, meeting planners have such a wide variety of choices when it comes to choosing a city. There are a number of variables they consider when ranking a destination's ability to host an event. According to STR's Destination Map, a national survey of meeting planners, quote, social political tension is the 7th biggest deterrent, with nearly 50% citing it as a concern in a destination selection. Political tension sits closely behind more basic concerns like safety, cleanliness, and cost. Competition for meeting and convention business is fierce. We are located between two very successful life sciences meetings destination, Boston and Washington, D.C. Both have done a great job in building their biomedical communities, and we often find ourselves competing with them directly. Among our competitive set, which includes DC and Boston, we currently rank in the middle of the pack on social political tension, with DC ranking considerably higher and Boston ranking lower than us. In order to retain our fair market share of life sciences related meetings, we need to keep our barriers to compete low. Should legislation like this pass, we won't have the opportunity to be in consideration as a potential host city for lucrative biomedical meetings and conventions. And in addition, the amendment that addresses business on the convention floor, it's important to keep in mind that many hotels do not book through the Convention and Visitors Bureau for the smaller pharmaceutical meetings, which also fuel our hotel tax, and the Phil's Fund, which goes by hotel rate, 75 cents per each $100 of rate. And the Phil's tax funds major special events in the city, like the Army-Navy game next weekend, where the city used to have to pay $450,000 to host that meeting. Because of the Phil's Fund, they are now only paying $150,000. So conventions, meetings, large and small, whether they're organized by the Philadelphia Convention and Visitors Bureau or not, all of those are important. The most important point I want to make is, with the high caliber of the life sciences meetings and conventions that we land here in Philadelphia, we have such an opportunity to capitalize on the fact that we bring some of the best minds in this business together right here in Philadelphia. And we could leverage those opportunities, as Chris Molyneux has pointed out, to work collaboratively and develop a creative solution to this epidemic together. And we welcome the opportunity for further discussion on this matter and hope you will consider this potential for lost business, lost tax revenue, and the negative impact that Bill 180888 poses on tourism and hospitality. Thank you.
Thank you. Thank you for your testimony. And if we could have Angela state your name for the record and begin your testimony.
Okay, thanks. My name's Angie Gockenauer. I am the Eastern Director of Government Relations for the Biotechnology Innovation Organization. which I'm going to call bio for the remainder of my testimony because it's just way too long. But anyway, so bio is the world's largest trade organization representing biotechnology companies, academic institutions, and state biotechnology centers, and related organizations across the United States and in more than 30 other nations. I want to start by commending the Council on its desire to curb the growing addiction problem, and we at BIO are committed to working with all stakeholders and policymakers to address the crisis. In fact, BIO and member companies have joined together to identify ways in which the biotechnology industry can assist in mitigating the epidemic and address the crisis. Our activities have focused around 3 key pillars. 1, advancing the understanding of the biology of addiction to enable the development of innovative treatments for pain and addiction, for ensuring those suffering from pain are able to receive the right treatments, and stimulating research and development of innovative treatments so to help prevent abuse. The biopharmaceutical industry offers real solutions to this devastating crisis. Emerging biotechnology companies and established enterprises are working hard to transform the standard of care for pain and addiction through novel and safer next-generation therapies. I want to give you a few examples because as we don't know quite yet if they will be scheduled substances, disallowing coupons for these would also, put a burden on patients to have access to these new therapies in the city of Philadelphia. For example, there's one technology that's an injectable that treats knee pain using capsaicin, which is actually a byproduct of chili peppers. There are novel and safer products for post-surgical pain control and partnering with large hospital chains to develop alternative approaches to pain management. There are also abuse deterrent formulations of existing therapies that mitigate or prevent abuse of the therapy. So these novel and state-of-the-art therapies that are the object of the research of our member companies demand that companies help provide education to healthcare professionals. These educational interactions help healthcare professionals make informed decisions in consultation with their patients based on the most up-to-date information. These interactions are held to the highest ethical standards so that we maintain our bond of trust with patients and healthcare providers. BIO believes that policies aimed at addressing the opioid crisis should focus on concrete solutions to help ensure patients suffering from both pain and addiction have access to the most appropriate form of treatment across the continuum of care, bringing stakeholders from different sectors together focusing on these solutions. For these reasons, we believe policies such as this proposed ordinance may not be appropriately focused on addressing the needs of individuals who suffer from addiction. For these reasons, we respectfully oppose the ordinance as written.
Thank you very much for your testimony. Any questions? Yeah. Councilwoman Brown.
Good afternoon. The record should reflect that and in the interest of full transparency, I'm a member of the Board of the Philadelphia Visitors and Convention Bureau and have expressed my concern on how the bill would impact the hospitality and tourism industry. And the sponsors of the bill have heard my concerns, listened to my concerns, and acted upon my concerns, which is why the language around hotels and the hospitality and tourism has been addressed and will further be more deeply articulated in the regulations. So you need to be assured of that.
Thank you.
And as well as the request for the 100, the longer extension. We said 180 up here, not knowing that you had 180 in your testimony. Lastly, review briefly this notion around how coupons could still have a negative effect, because that does trouble me. The gentleman on the end. Whoever spoke up, I think you spoke at length around the coupons still do not get us where we need to be.
Actually, Sharon might be better equipped to comment on it, but I'm happy to reiterate what I said, and that is that the coupons are designed to help low-income patients be able to afford their medications. And with legislation as broad and sweeping as this is, that would include all medications, including medications that are being used for patients who are currently going through rehabilitation, gradually being weaned off of opioids or highly addictive treatments. And unless that language is changed, it would affect them as well.
Okay, then we need to be conscientious on this side to make sure that the amendment captures
that concern, yes.
Exactly what you just articulated.
Yes.
Councilman Greenlee.
Point of information. I'm sorry, let me find it here. We did address that, and it has to do with, I'm not looking at the latest amendment here. Let me see the latest amendment. Thank you. says the provision of samples, prescription drug, this exemption shall not include the provision of coupons for the purchase of any controlled substance, and this is the added language, unless it is indicated for the treatment of substance abuse disorder.
Thank you.
All right. I'm glad somebody said thank you eventually. Thank you.
Okay, any additional questions from the committee? No? Okay, well, thank you very much for your testimony.
Thank you.
Is there anyone else here to testify today? Okay. And I know we have former Controller Alan Bukovitz to testify. Good afternoon.
Well, first of all, I understand the council's grave concern with the opioid crisis and their struggle to find innovative ways to deal with it. I'm just concerned about the process that's being followed in this case. I'm a 30-year diabetic. I have worked a number of years, including in product liability litigation, and I think that and in the course of that, we had to do substantial research on congressional regulation of prescription drugs. And I'll tell you, for one prescription drugs, there's congressional testimony that looks like this, and the legislation that governs it looks like this. We have something like a 4 or 5 page bill here with holes that you could drive the proverbial truck through. It was just announced the other day that Michael J. Fox has funded the development of a new anti-Parkinson drug that is immediately able to stop the death of brain cells. There are people out there who are praying for the quickest application of that kind of technology and biological and pharmaceutical advances as possible. In the diabetes field, I started going to an endocrinologist about 20 years ago, and the quality of care vastly improved. Every week, they go into market with some brand new pharmaceutical that are literally saving millions of lives. That's why American healthcare is the envy of the world. So, and it's well known now that there's a very substantial political fight over whether or not children should be vaccinated before they go to school. So there are a number of things that are taking place with the consideration of this ordinance. First of all, as Mr. Molyneux indicated, the Food and Drug Administration does a tremendous regulatory job. The reason that people can't get access to the drugs as soon as they want is because of the very involved, very deliberate, very scientific process that they have to go through to make sure there aren't adverse impacts. They also regulate the content of the advertising, and they have not only $5 billion in money, but they've got the best experts in the world evaluating and using their judgment to determine how the risk-benefit is to be weighed in any given case. So what will happen under this legislation? First of all, the whole idea that the FDA is going to be second-guessed by city legislative bodies is going to open the door to groups like the anti-vaccination people, groups like the anti-birth control people, there are like more than 100,000 municipalities in this country. So instead of doing a deliberative, scientific, federal regulatory process, Philadelphia is going to try to go on record to say every township, every borough, every municipality in America should have its own rules on prescription drugs. That's a very bad precedent to set. Although there are many people that are being severely damaged by the opioid crisis, there are also people who are being damaged by diabetes, by many other chronic diseases, by cancer, and by all sorts of conditions that are being remediated by the cutting-edge work that's being done by the pharmaceutical industry. Now, when I was controller, we did audits of the health department, and we uncovered problems like the fact that if you want to make an appointment for a regular physical exam in a health clinic in Philadelphia, it takes up to 6 months to get an appointment. There was a New York Times front page story over a decade ago saying that one of the particular scourges in the African American community was the unequal treatment of diabetes, which is a particular problem in the African American community, and that a practice had developed where insurance companies would routinely accept the amputation of a foot and other kinds of radical. We know people who have been in public office in Philadelphia who experienced that kind of thing, whereas the introduction of some of the new drugs that help ameliorate the condition would do a lot more to extend life and quality of life. So my question is, if the health Department of Philadelphia is looking to do something that's really useful for the very many people who need improved public health care in Philadelphia, how about taking care of the many people who have diabetes and chronic diseases in the poor neighborhoods of Philadelphia and making sure that they get quality of care? Now, the reason that they're not doing it is because they don't have the resources to match the problem that they're confronting. So how in the world, how many staff people are they going to dedicate to reviewing drug inserts in these pharmaceuticals? If they wanted to do what the Deputy Health Commissioner suggested, they already have the ability to do it by accessing the database at the Food and Drug Administration. They can look up all the information they want. So that raises a second question. I had a hard time understanding what you're trying to do in the section of the bill that deals with the filing of advertising and insert materials with the City of Philadelphia. Because if it's the intent of the city to regulate it, then why don't you say so? If it's the intent of the city to censor or edit those drug inserts, say so. But you don't really say so. You say, we want you to file it with us so that we can consider whether we should develop continuing education programs for detail representatives. And it doesn't even prescribe what you're thinking about or what that will mean. Does that mean that if the health commissioner of Philadelphia has a different opinion than the manufacturer of the useful indications of a particular drug, that they're going to send detail people to seminars over and over again until they parrot the thinking of the Philadelphia Health Commissioner? Does it mean, and as a lawyer, I suspect that this is one of the goals, does it mean that it's going to try to create a new standard of care in the use of some of these medications so that plaintiffs' lawyers in Arizona, in Philadelphia, maybe even in Arizona, will say that now there's a statute that prescribes a certain re-education program, actually it sounds like China, and that if the practice that you followed in a particular case doesn't conform to the content of the training materials, that somehow that's a new violation of a standard of care and lays a foundation for a product liability claim or for a negligence claim against the doctor. I think the bottom line on all of that is when legislation like this moves through a legislative body like the Congress, first of all, they negotiate with everybody who knows anything about the substance of the issue. They have a hearing not for half a day, but they have hearings that consume many days with the most recognized professional literature in the field and with the best experts in the field and with a lot of technical support to the legislators. And over a period of time, they make a decision that is scientifically sound. We're moving to, whether it's global warming or whether it's vaccinations, we're now politicizing things that should really be science. I think the request that this action on this bill be postponed so that there can be consultation with experts in this field is really well indicated. I will say that the one thing that I agree with enthusiastically in the bill is the banning of gifts. Although I must say, because I don't take any gifts, and I must say that I had occasion to look at Mayor Kenny's filing, and I noticed that he had something like $12,000 or $20,000 in free Eagles and 76ers and other tickets, and I know members of council, sometimes they accept those and they give them out to constituents. know whether you've stopped to think for a second that what you're saying is that you believe that a cup of coffee corrupts somebody. And yet, there are many people in council who, on their financial forms, indicate thousands of dollars of gifts. So if that is in fact your belief, I think you have no choice but to amend the ethics legislation to do what the mayor's actually done for his own appointees, to say that no city elected official can accept $1 in gifts. I think that's an appropriate action. To try to say that about doctors and to slander doctors like that while saying we as council people, you know, we're able to make decisions about sports stadiums and issues that affect these groups, and the fact that we got free tickets and free dinner doesn't affect our judgment is just hypocritical. And it's a further example of the rush to judgment here. Things are being amended for today's meeting as the testimony proceeds. So what does that mean? That means you haven't done enough homework to be able to understand this issue and to not be in the position that so often happens with councilmanic legislation, that you got to rush to try to fix something after the cow's out of the barn door. I think based on the testimony that's been presented here today, and I think the members of this committee are particularly thoughtful, and I think they really do strive to do the right thing, that the right thing is not to try to bully through or strong arm a decision today. The right thing to do is to take note of a lot of the facts that have been presented in the testimony, and to do a period of postponement and to consult with people who really know from experience the impact that this can have on all sorts of patients and all sorts of people. And you know, I don't think it's a question of dollars or tourism or any of that. I think that in this area we're trying to weigh what is the best medical care and what is the best health impact we can have in individuals' health. And the focus, you've had like blinders on, like horses, looking at the opioid problem, and I don't think there's been consideration of the chronic disease problem and of the life-saving impact of many of these pharmaceuticals on so many Philadelphians. And I think that really, you should step back and consider that impact. Thank you.
Okay, thank you for your testimony. Any questions from the panel? Nope, okay. Is there anyone else here to testify? Okay, seeing none, we have now...
There she is. I didn't see her.
Okay, there she is. We've now concluded the public hearing on bill number 180888. We'll now go into a public meeting to consider the action to be taken on this bill.
I'm sorry, what did you say?
Okay, and I want to recognize Councilman Bill GREENLEE for a motion to amend bill number 180888.
Thank you, Madam Chair. May I just add very quickly that as we have been when we were discussing this bill before today, we were always open to talking with people and hearing ideas, and even if we eventually council moves this bill, we can certainly keep our doors open and keep discussion. Yes. And if we have to make any changes. Thank you. Madam Chair, I move that the amendments that were presented to this bill be approved.
Second. Okay. It's been moved and properly seconded that the amendment just circulated and be adopted. All those in favor of the amendment signify by saying aye. Aye. Any opposed? Okay, no. Chair recognizes Councilman Bill GREENLEE for a motion on bill number 180888 as amended.
Thank you, Madam Chair. I move that bill number 180888 as amended be reported out as committee with favorable recommendation and the rules of council be suspended to allow for first reading our next session of council.
It's been moved and properly seconded that bill number 180888 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All of those in favor will signify by saying aye.
Aye.
Any opposed? Okay, we have one. In opposition? The ayes have it and the motion carries, and Bill number 180888 as amended will be reported from this committee with a favorable recommendation with a request that the rules of council be suspended to permit first reading at the next session of council. This concludes the public meeting of the Committee on Public Health and Human Services, and there being no further business before this committee, thank you all very much for your attendance.